Vanakkam, good morning. In this video, we are going to discuss about the countercurrent mechanism. Countercurrent mechanism is the important question from the renal physiology. Countercurrent mechanism in the renal system is important for the concentration of the urine. Countercurrent system consists of two parallel tubes. One tube is the loop of Henle, another one tube is the vasa recta. Loop of Henle is the continuation of the proximal tubule and it is continuous as the distal convoluted tubule and collecting duct. Vasa recta is originate from the efferent arteriole. So it is this is the descending limb of vasa recta. This is ascending limb of vasa recta. The countercurrent system consists of two parallel tubes with the opposite flow directions. Loop of Henle is flowing occur in this directions, anti-clockwise directions. The vasa recta flow occur in the clockwise directions. So it is important for the hyperosmolality of the medullary interstitium. Concentration of the urine mainly done by the juxtamedullary nephron. Cortical nephron main function is the formation of the urine. Concentration of the urine is mainly done by the juxtamedullary nephron. The countercurrent mechanism, the loop of Henle is act as the countercurrent multiplier. Countercurrent multiplier is the loop of Henle. So at the level of the proximal tubule, osmolality is 300 milliosmol per liter and gradually it reabsorbs water at the tip of the loop of Henle, at the Carpin bend of the loop of Henle, the osmolality is 1200 milliosmol liter. In the ascending thin segment of the loop of Henle, it is not permeable to water but passively reabsorbs the sodium chloride, and the thick ascending limb of loop of Henle is reabsorption of the sodium along with the chloride and potassium. This is the important factor for countercurrent multiplication. Then the thick ascending limb of loop of Henle reabsorbs the sodium along with the potassium and chloride. This is the one of the important reason for the multiplication, along with other areas having passive reabsorption of the sodium chloride from the descending limb and ascending thin limb of the loop of Henle, and medullary collecting duct reabsorbs the urea, more amount of the urea due to the continuous diffusion, due to the high concentration of the urea in the collecting duct. So this is also maintain the hyperosmolality of the loop of the tip of the loop of Henle. This is important for the countercurrent multiplier. And vasa recta is flow in the opposite direction. So it is the exchanger. Vasa recta is in the ascending thin segment is impermeable to water. Here is osmolality is 1200. In the ascending area, the osmolality is less. So here water is leaving from the descending limb of vasa recta. Same time it reabsorbs the sodium chloride and urea. The urea is facilitated diffusion from the collecting duct, that is again reabsorbs through the descending vasa recta, it is also maintain the medullary hyperosmolality. In the ascending vasa recta, it is secretes the urea and sodium chloride. Same time it reabsorbs the water. Reabsorbs the water. So it is important for the exchanger. Vasa recta is act as the exchanger. Again it is filtered through the glomeruli. So it is recirculate the water, maintain the sodium electrolyte composition. Every day 1800 liter of the plasma is filtered through the glomeruli, but only 1 to 2 liter, 1.5 liter urine is excreted through the urine. Remaining part is recirculated. So the vasa recta is exchanger. And the collecting duct, water reabsorption is mainly dependent on the ADH and continuous diffusion of the urea due to the high concentration. The urea is maintained the reason for the 50% of the hyperosmolality. If the concentrated urine is 1200 milliosmol, mean the 40 to 50% of the hyperosmolality is mainly dependent on the urea. So and the sodium and chloride is the remaining 50%. The sodium is contribute the 300 milliosmol per liter and the chloride contribute the 300 milliosmol liter. So during the normal hyperosmolality is 1200 milliosmol. During the hot climate it is concentrated very much up to 1400 milliosmol per liter. During the cold environment the hyperosmolality can decrease as much as up to 30 milliosmol per liter. So the range is from the 30 milliosmol per liter to 1400 milliosmol per liter. Thank you for watching this video. If you like this video, share your friends. Those who are not subscribed this channel, please subscribe. Thank you once again.